Welcome to our LegalOne webinar on coronavirus in our schools, getting the facts, planning for the future. We know that this is a very difficult time for all of us in the state of New Jersey. It's a time where we need to come together. We need to support each other. We need to make sure we're doing everything we can to support all of our students. And we need to do what we can to plan for the challenges that are inevitably going to come as we work to overcome coronavirus in our schools. So this is a unique webinar today. For those of you who have seen prior LegalOne webinars, we offer them on a whole range of issues. Today, we brought together some leading experts to help all of you think through how do we best plan for and address the challenges associated with this pandemic. In addition to myself, again, my name is David Nash. I'm the LegalOne director. We have a number of folks with us. We have Dr. Wayne Yankus. Dr. Yankus is an experienced school physician who has done a great deal of work with us on legal issues related to student health. So Dr. Yankus, thank you so much for being part of our presentation today.
You're welcome.
We also have with us Jeff Gale. He is the Director of the Office of School Preparedness and Emergency Planning with the New Jersey Department of Education. And when it comes to emergency planning, there is no one who has greater expertise in the state of New Jersey than Jeff Gale. So Jeff, thank you so much for being with us.
Oh, you're welcome. Thanks for having me.
Absolutely. We also do have with us Tom Gambino from Jeff's office. Tom has done tremendous work across the state as well. So Tom, thank you for being with us as well.
Thank you, David.
We have John Worthington. John has done great work with us here at LegalOne. Prior to coming on board with us, he was the director of the Office of Special Education for the New Jersey Department of Education and has brought a tremendous amount of expertise to our work. So thank you so much, John.
You're welcome. Thanks for having me.
Of course, and always we have Rebecca Gold. Rebecca has been with us for our full online series that we have developed when it comes to webinars. Rebecca is an interim director of human resources as we speak, and just comes with a wealth of experience. So thank you, Rebecca.
Thank you all.
So as we get ourselves started, we're very excited that we do have so many people who have decided to take advantage of this webinar. We do encourage you to participate in the webinar using your desktop or laptop rather than a smartphone or a mobile device. It'll help make sure you have the best possible experience. You will have access to this presentation afterwards. We are archiving this webinar. It will be made available publicly, and we will make sure that all of you directly have access to it and to a wide range of resource materials as well. We're also going to encourage you throughout, if you have questions as we go, to type those questions in. Of course, we have over 300 folks who are signed up, so I can't say we're going to be able to answer every one of those questions now. Rebecca Gold will be screening those, and we do give you an email address at the end for any specific follow-up questions that you might have as well. As we walk through this presentation, we're trying to give you the best possible information, the latest information. Of course, we are not giving you legal advice as we walk through this particular presentation. For many of you, you are members of New Jersey Principals and Supervisors Association, and we do urge you, for any legal questions you have, please reach out to us at NJPSA, and we are here to support you. We are here to give you whatever support you need in addressing these issues. Our purpose today is to give you that latest information and to help you think through how do we address all aspects of the challenges that we're dealing with. So in our short time today, this is our game plan. Dr. Yankus is going to help us walk through some of the basics on coronavirus to make sure that we have a common understanding and that we do not have the misunderstandings that sometimes come when we're dealing with this sort of an issue and we're dealing with the fear and when we're dealing with social media and some information that could be spread that is just not accurate. So we're going to make sure you have accurate information. We're going to talk about issues of confidentiality and information sharing, which can be very sensitive. We'll talk a little bit about employee rights and employee responsibilities. We'll talk about issues that could emerge while we're in the middle of addressing coronavirus, potential issues of harassment, intimidation, or bullying, mental health issues that students or staff might be dealing with, and a number of other emerging issues that we have to make sure we grapple with. We will talk about district plans. Every district in the state of New Jersey has now submitted a plan, and those plans have been reviewed by the Department of Education. Within your plans, we know there are certain core issues that were challenging to address. So we'll talk about issues of nutrition, equitable access to instruction, special education and related services, and give you the best information we can on all those fronts. So as we get started, I think it's important for us to sort of take a deep breath and think about where we are. This is a challenging time. This is a global pandemic that we're dealing with. We will get through this. We do understand the steps that need to be taken for us to grapple with this issue, and it's critical that we all do our part. We know that the governor has declared that state of emergency, that we have had public health related closures, including, of course, of our schools. But we also know that it's critical that we continue essential services, including making sure that all of our children are receiving the educational services and the related services that are so essential. And for us here at the New Jersey Principals and Supervisors Association, we can't say this enough. School leadership is critical. You set the tone for your building, you set the tone for your community. And even as we are moving into this phase of virtual learning, it's critical that you think about the school climate that we have and having a safe, supportive school climate, even in the times that we are now. So as we get started, we of course do have to think through the requirements that we have to meet under state law. There is a requirement for all students to have 180 days of instruction. The Department of Education has moved very quickly to provide guidance on that issue. One of the things that we give you a link to is the Department of Education checklist that really makes sure that we are addressing critical aspects of planning when it comes to this challenge. So as a legal matter, it is critical that every school principal, every administrator knows the ins and outs of your particular plan. There are no two plans that are exactly alike from one district to another, but your community, your school district has committed to a certain set of strategies. It is a legal document. We have said this is how we're going to ensure that we have equitable access to instruction for all students. This is how we're going to make sure we're meeting the needs of special education students, how we're going to make sure that nutrition benefits are being provided to all students. So it's essential that as school leaders, all of our administrators know these plans, make sure that everybody is on board, and where we have questions, and we will, that we have the kind of communication we need to overcome those challenges. So as we get started, another piece that we wanted to give you was the latest links so that you can have up-to-date information. We resisted the temptation to include any specific statistical data. We knew that any data that we gave you would potentially be outdated very quickly. So instead, we're giving you essential links. We are going to, at NJPSA and FEA, we do have a specific link that helps you in one place have the latest information. And we give you that on the top of this particular page. And we're going to be constantly updating our link to make sure you get that latest information, whether it's from the New Jersey Department of Education, US Department of Ed, CDC, New Jersey Department of Health, or other essential sources. So as we get ourselves started, Dr. Yankas, I thought it would be important for you to help us understand what is coronavirus. So let's start with that basic question.
Sure. Coronaviruses are seasonal respiratory illnesses that have been around forever. What makes this different, what makes this called a novel virus, is because it's new. We don't know the incubation period for sure. We don't really know how long you can shed the virus in saliva and urine and stool. And we don't actually know how long it can stick on surfaces, although we're getting a better idea. The symptoms are basically, it started in China. It has moved as the world moves around the country, and it is obviously a contagious illness. Now remember, we just finished a measles outbreak throughout the United States not too long ago, so we are primed for these kinds of things. The difference is because it's a virus and there is no treatment and there is no vaccine, the only way to prevent getting and preventing the spread is the obvious: not touching your mouth, not touching your eyes, washing hands frequently. We tell the kids, sing happy birthday twice. It takes about 20 seconds. Be sure to get your fingertips using soap and water. If soap and water is not available, obviously schools, when available, can use hand sanitizers that are greater than 60% alcohol. The most important thing, I think, for schools and children to keep in mind is close contact. Schools are intimate. That is to say, we are close, particularly in the elementary grades, our seating arrangements and the like, and close contact makes this more likely to be caught. And of course, the older you are, when you finally get in your 60s, 70s, and 80s, exponentially, the potential for illness and death is quite a bit worse.
And
So
when we
it is
talk about
spread.
just like the close contact piece, just to be clear, the CDC has talked about 6 feet as kind of
Correct.
within that range as being close contact.
When the average person sneezes or coughs, the respiratory droplets spread anywhere from 4 to 6 feet if it is uncovered. That's important. I think we have to remember too, we're also with a virus that we don't know if this is seasonal like other cold viruses. Will this end with warm weather? We don't know. So the uncertainty creates a lot of anxiety, and not having all the scientific knowledge makes this difficult for all of us. So the symptoms are fever, cough, but key is shortness of breath. Shortness of breath is not just your actual cough or sneeze, but it's difficulty taking in a breath. It's a difficulty of honestly going on. The average adult breathes 14 to 18 times a minute, children 21. When you're short of breath, you're breathing much more than that. And of course, because it affects the lungs, what happens to older people who get this and become profoundly ill, or younger people who have immune deficiency that this affects as well, you get a lung filling that then reduces your capacity to spread oxygen around your lungs. Some patients will have pneumonia in both lungs, as mentioned here, and then once you start messing with your breathing, your heart goes thereafter and your organs fail in succession, which is why the cry for respirators or ventilators is out there, because when you are at that point in the disease, you need respiratory support.
Now, you did mention this, but just to review again how people could protect themselves, some basic preventative measures that we could take.
Avoiding close contact for people who are sick, and this is much like HIV. You have to assume almost everybody has it. You avoid touching your eyes, nose, and mouth, which is the entry to your respiratory mucous membranes, and wash your hands often with soap and water for at least 20 seconds in warm water if available, or hot water, and using alcohol-based sanitizers that contain at least 60% alcohol if soap and water are not available. It would appear soap and water at the moment is more available than alcohol. In schools, we got away from using bar soap a long time ago. We had dispensers, and again, that still would be the safest way of going about washing your hands.
So some basic pieces, of course, we do not currently have a vaccine, and that process does take some time. Dr. Yankas, is that correct?
18 months to 2 years at least. And then, of course, like most vaccines, we have to decide whether it will be available to which population. And then, of course, vaccines in the state of New Jersey don't have a lot of good press lately, as you can remember,
Sure.
in the testimony that happened earlier at the end of last year. There is no treatment, and social distancing and preventive measures are about all we can do right now. And as you say on the slide, the dangers of misinformation This is the anxiety that comes from the uncertainty and social media. And we have to be very careful to listen to the people who should know. When you look at TV, Dr. Anthony Fauci, the short little guy from Brooklyn with the white hair, he's certainly somebody to listen to.
Yeah, you want those reliable sources of information. So
Correct.
certainly looking at the CDC, the New Jersey Department of Health, those are the kinds of sources that we should be looking at for accurate information.
Correct.
So we do have challenges that have occurred already in some New Jersey school communities where perhaps there is a positive test result either for a student, for a staff member, for a parent in the community. And now we have to think through what level of information do we share, how and when do we share that information. So we have given you here links to guidance provided by the New Jersey Department of Health regarding communicable disease and requirements to share information when there is an imminent danger to the health and safety of others. We've also given you information from the U.S. Department of Education, which provides guidance on FERPA and students who may have contracted COVID-19 and information that can be shared. Generally, under the state and federal laws regarding both confidentiality of students and staff members, we are looking to do whatever we can to maintain the specific confidentiality of a particular student or staff member. That is the general rule, but there are times where certain information does have to be shared. So if we have a student who has been in close contact with someone who has a coronavirus or COVID-19, now we have some important considerations that come into play. So again, what do we mean by close contact? You live with someone or care for someone who has COVID-19. You have been within 6 feet of that person for more than 10 minutes. You've been in direct contact with secretions from somebody who has COVID-19, being coughed on, kissing, sharing utensils. So when we have that direct contact, it is critical that that individual take certain steps, not go to work or go to school, avoid public places, except to get medical care for 14 days, monitor their health or fever, cough and shortness of breath for 14 days, contact their healthcare provider to let them know if they've been exposed, if they're pregnant, have other underlying medical conditions, or are older than 60 years old. So one of the challenges we have is that sometimes we do have a duty to warn others in the school community when we become aware that a particular student or staff member has contracted COVID-19. But in the vast majority of cases, there is no need to reveal the name of the individual who has tested positive. It's sufficient for you to inform students, to inform staff members that there is a person, and to make sure that the students or staff members now know to take the appropriate measures that we're talking about here. If you have somebody who has had minimal contact, hasn't had close contact the way we've defined it here, you are considered at low risk for infection, but you should monitor your health for 14 days. And in order for people to do that and to have a heightened sense of awareness and monitor their health, there does have to be notice. So even when we don't have what we call close contact, there is still that need for notice. So this is an important issue. We know it's come up in some school communities. Under FERPA, school communities do have a right to identify an emergency situation that allows for the release of some particular information, and we have given you a link to that FERPA guidance. In the same way, we do have a general obligation to protect confidentiality of information regarding staff members, but in a case like this where a staff member has tested positive, while we don't need to reveal the name of the staff member in the vast majority of cases, there is a duty to warn individuals who may have been exposed. Any comments on that, Dr. Yankus?
No, I think it's very clear. The object, of course, is by taking yourself, if you have been exposed, and giving yourself self-quarantine, you are then not likely, if you do become ill, to spread it to 2.6 people who you otherwise would have been in contact with. It breaks the chain and it flattens the curve that our public health people have talked about. While that
So,
may push out the illness longer, it certainly prevents more deaths. And I think that, again, people should be looking cough, fever, shortness of breath. There will be other illnesses that happen at this time. Flu is still out there, but it's distinctly different, and there's treatment for that.
absolutely. So as we are thinking through these issues, of course, each one we could spend a great deal of time on, but we do want to touch on a number of important issues. As we're struggling through this pandemic and everything that comes with it, there are tremendous issues of student mental health that we have to be aware of. So our school leaders, as part of your planning, we need to think through how do we continue to provide essential services to students who are in need. Think through in your planning the role of the school counselor, the SAC, the school psychologist, our other professionals that are on an ongoing basis providing support for our students. We will have situations inevitably that come up where students who are engaging in virtual learning show some signs that they are struggling with their mental health. And in some very serious situations, potentially show signs of even suicidal ideation. We have to make sure that the risk assessment protocols that we have had in place for many years, when issues come up within the school setting, that we apply those risk assessment protocols if issues arise in a virtual setting as well. We have the same legal obligations if students are indicating that they're in trouble, whether it's happening through virtual instruction or in-person instruction. And in some cases, that might mean that we need to contact emergency responders and make sure that somebody can get to that student immediately to address their issues. So we also give you here just some practical talking points and some guidance on how we talk with parents and how we talk with students about these very difficult issues. So we give you links from the National Association of School Psychologists, the Child Mind Institute, the CDC, the World Health Organization. And we know that so many districts are doing a great job at addressing social and emotional learning and understand the importance of addressing mental health issues. We just have to make sure that while we are struggling with so many challenges here, that this issue is always at the forefront of our thoughts. We also give you here very specific resources because we will have, unfortunately, those situations where students are expressing suicidal ideation. Separate and apart from coronavirus, we have seen in the state of New Jersey in the first 2 months of this year, a very large uptick in students who are attempting and completing suicide. So we give you here a great deal of information on resources that we should be utilizing at this very difficult time. We also want to remind folks that there is a danger that individuals can be stigmatized. When you have fear, when you have misunderstanding, stigma can result, and harassment, intimidation, and bullying can result. The CDC warned about this, and they reminded folks that we have populations that are being singled out, and this is causing real harm for some students. We have seen, for example, students who are Asian American who are being targeted. The Jewish community being targeted. We have seen others as this pandemic has spread throughout the world, students coming from a wide variety of countries or backgrounds or ethnicities who are being targeted. And we have to be sensitive to those issues, respond to them quickly, and take a strong leadership role that this will not be acceptable, even as folks are struggling with the fear of the unknown. So our HIB protocols still have to be followed. Sorry about the echo. If we become aware of a potential bullying issue, we have to make sure that we're still responding in a timely fashion. So if we find out about something that's happening in the community, student might have been singled out because of their race or ethnicity or their nationality, the clock is ticking. We still have 10 school days to do that investigation. And we still have to make sure that we submit a report. So 10 days to do an investigation, 10 school days, 2 additional days to write a report. Now, in many of these cases, we will not be able to effectively do that investigation within that timeline. So what we need to do is still submit a report that goes from anti-bullying specialist that the principal should review, that goes to the superintendent, and that information still needs to be reported at the next board meeting. So in many cases, that report might say we're unable to reach a conclusion at this time because we are not able to fully investigate the matter given the situation that we're in. And the report will be amended at a later date. That's okay. State law allows us to submit a report that will be amended at a later date. What we can't do is simply put the investigation on hold and do nothing. If we fail to submit a report, if we fail to follow up on this issue, now we would be in violation of state law. And unfortunately, we may run into a situation where virtual learning is going on for an extended period of time, and we may effectively have to do virtual investigations where we are taking statements electronically, where we are interviewing students and other witnesses remotely, and we may inevitably have to do that if we have an extended period of health-related school closures. We also have to be aware that there are other rights that could come into play. We may have staff members who, even while we are in this virtual learning phase, invoke their rights under New Jersey Family Leave or Family Medical Leave Act. You may have staff members who have just good old-fashioned colds or other other illness and need to have a sick day. So those issues will still arise. Your protocols should very clearly address those issues, and staff members should still be following established protocols if they are going to use a sick day or if they are requesting any sort of an approved family leave. For our administrators, we have to make sure that we are supervising all of our staff. There needs to be an adherence to the workday. Just because we are in large part working virtually doesn't mean that a teacher or a counselor or another staff member gets to decide I'll start my workday 30 minutes later, or I'll take a very long lunch break in the middle of the day. So we still have to ensure accountability for that workday and have clear expectations and have systems in place so that we can appropriately supervise all of our employees. The New Jersey Department of Labor has provided important information. Questions have arisen regarding staff members' rights, and the Department of Labor has put together a helpful one-page document that walks through various scenarios for employees and whether or not the employee would be entitled to either earned sick leave, unemployment insurance, temporary disability or family leave insurance, or workers' compensation. So that one-page chart is a very good resource to make sure that we understand and are protecting and honoring the rights of all employees. The Department of Education has done a great job at putting out a tremendous amount of information to school districts during these difficult times. We have a guidance document most recently that came out just yesterday, and we give you a link to that guidance document. It walks through a number of important questions, including issues of student attendance, making sure that we have plans in place that allow us to meet the 180-day requirement for education, specific information regarding the provision of services for students with disabilities, special education and related services, issues regarding food service that we will have in a moment. Jeff Gale walked through with us. The department is very aware of some of the challenges that we are facing on issues of assessment. The U.S. Department of Education is aware of this as well. So some of the requirements under federal law are under review when it comes to our testing requirements. And the Department of Education is in constant contact with the U.S. Department of Education regarding potential adjustments to our state testing schedule. There's also information in this guidance document that came out just yesterday, March 17th, regarding educator preparation programs. Colleges have very specific requirements for students who are preparing to become educators. Specific information regarding approved private schools for students with disabilities. New guidance regarding the operation of school districts and making clear that a district does have the right to conduct a virtual Board of Education meeting, provided the school district appropriately notices that meeting, that members of the community are able to access the meeting and participate and actually be engaged and ask questions during that meeting, which we can do virtually. So very important that we do have very specific information regarding virtual board meetings and how they can be conducted. We are expecting additional information that has not yet come, but we do expect to receive additional information from the New Jersey Department of Education regarding the issue of staff evaluation. We know that we have very stringent requirements when it comes to observing and evaluating all staff members, and there are lots of logistical questions that come with where we are now with virtual learning. So we cannot today give you additional guidance on that issue, but we know that additional guidance will be forthcoming about how we handle observations and evaluations in this virtual environment. The Department of Education has, as part of the resource material they provided, given an incredible resource document that allows you to have county by county information on who your contact person is with the Office of Emergency Management, the food service companies that are recognized within that county, the summer food service program providers that are available within that county. The guidance document that came out March 17th from the department walks through how school districts can receive federal funding while providing food services to students remotely. We've given you here some additional links as well, FDA guidance on food products and CDC guidance on food safety that are very important. So with that, I do want to turn to Jeff Gale. The Office of School Preparedness and Emergency Planning is taking a real leadership role in helping districts with some of these challenges and very specifically challenges related to food distribution and supporting our students' nutritional needs. So Jeff, why don't you take us from here? And you can sort of prompt me, I'll move forward your PowerPoint for you.
Okay, so you can hear me okay?
Yes.
Okay, I thought you were going to say take a real beating, not a real leadership role, because we've been taking a real beating the last couple, about the last week, I guess, right, Tom? So where we are right now, last week I found out that in the a cabinet meeting in the governor's office, when the governor expressed his concern for making sure that we get all of our kids fed, he was asked how that was going to be accomplished, and apparently it was decided that that I was going to take care of that. So we've been working on that directive ever since, and I think so far so good. If you want to go ahead and hit the next, you can add one more. So that thing might have had one more. This might have gotten corrupted a little bit in the translation. It's okay. So just to describe to you all generally what's going on behind the scenes. We have up at the state police, the Regional Office of Information and Communications. It's known as the ROC. The ROC was put in, established, it was built and put together, and the framework is based on the National Incident Management System and the concept of incident command. And it is there now to ensure a streamlined chain of communications and distribution of resources during crisis and emergencies. There are different levels of activation depending on what the nature of the circumstance is. But in general terms, the idea is that at a state level, we share the information, we push information down to the appropriate stakeholders, and that the issues that arise in trying to meet their needs as they're identified come back up that same chain, so the resources are used along the way. So when you're looking at this this chart, what you're essentially looking at is on the left-hand side, the flow of information to the field. This is specifically with respect to field services and how we're handling this particular crisis. So the commissioner is filtering out information to the field through Assistant Commissioner Hassan, who is in direct communication with me as to the needs of what's going on, what the commissioner's concerns are, what he's hearing or is in need of in the way of information, or that we have in the way of resources to be provided. And as that information comes to me, I am to provide that information or those resources to the Executive County Superintendent and simultaneously the County Office of Emergency Management coordinators. The Executive County Superintendent will obviously be pushing information down to the district, and the county Office of Emergency Management Coordinator is pushing information or requirements or requests down to the municipal coordinator. The idea is that at that level, we're best able to meet the needs of the community in most cases. So with regard to what's going on with the food distribution, when I was tasked with this, what we determined to do is that this was going to be the model that we used, and we could facilitate this activity through the Regional Operations Information Center. So in essence, what we did was the districts were all asked about a week ago to put together their closure plans. They weren't specifically asked for a food distribution plan, unfortunately. What ended up happening was I was presented with 600 and some plans, and we were asked how we were going to look at all these plans and figure out who needed what, which is obviously a task that there's no way we would have been able to handle from my office. But more importantly, we don't have the individual knowledge for any given school district as to what their needs are, what their circumstances are, and those decisions are always best originated at the ground level. So what we did was we took all of the county plans, and I put out emails to this. Hopefully most of you have seen some of this in emails. I've been trying really hard to be proactive in getting the email information out to the counties and to our school safety specialists. But basically we took those plans as they were, whatever they consisted of, and we provided them in folders by county. So all the schools in Monmouth County got put in a folder for Monmouth County, and they all got sent to the Monmouth County Office of Emergency Management County Coordinator. That county coordinator then in turn went into the folders, pulled out the individual school plans, and pushed them down to the municipal Office of Emergency Management Coordinator, with the understanding that that coordinator was going to line up with the school district that they oversee and help them with whatever resources they might have available to afford to them. The plans were sent also with what we quickly pulled out as in the way of an exemplar or a model plan, basically something that we found. And again, we didn't have a whole lot of time to do this, but Hamilton Township School District in Mercer County had a pretty good set of criteria that they were using. We pushed that out as something to approximate, and we also put out a guiding principles document to those coordinators so that they could look at some guiding principles about safety for these sites and look at an exemplar plan, and then speak to the district and say, hey, where are we with this? Are we close to this? Is there something we can do to help you with this? So that's how these plans went down. Some of those plans were nothing more than really an objective. We are going to continue to feed students for their free and reduced meals. Others were more detailed, but we left that to the local level to hash out. Going back up the chain, you can stay on that for a minute if you would,
Sure.
Dave.
Sorry about that.
Going back up the chain, let's just say, and we had this incident happen in Union County. They had a fairly decent plan. They weren't going to be able to feed kids until next week because they did not have the means to distribute these meals. They were okay with the food service portion. They were not really in a position to get people on board to physically hand out these meals. So the way the system was designed, as soon as that need was identified, I was notified by the executive county superintendent that at the district level, they had a problem with this. Because of that notification, was able to connect them with their county OEM coordinator, and who pushed me down to their municipal coordinator, made the contact information there, and I lined the district up with their municipal OEM coordinator, who was able to provide them the boots on the ground to actually hand out the meals. And so as that problem came back up the chain, and once it hit me, I was able to connect those resources down at that lower level. And in so doing, they were able to provide meals today instead of next Monday. And then I pushed that information up the chain to make sure that the commissioner eventually finds out here was an issue and here's how it was resolved, and the problem was taken care of using those resources. It's important to understand one thing about that. Those resources, in many cases, if the municipality has resources available to support your district, and they are not the first level of resources that are requested, and let's just say a call went directly to the state for assistance, the resources that are provided would not necessarily be reimbursed because this chain was not followed. The idea with all of this, and this is why we had the specialists get incident command training at our academy, is that as things come up the chain, if the municipality can't handle the resource request, it goes to the county. The county then tries to help them address their resource request. If the county can't handle it, then it goes up to the state level, and we start leveraging partners at the higher level to try to make sure that we assist. So it's possible through this whole process that we may run into shortages of food. We may run into shortages of staff. That is the intended flow that we are going to transact business, basically, with regard to information and supplying needs. So does that make sense to everybody out there, or did I just speak in a jumbled mess?
It does make sense. If you don't have this sort of chain of command, the system can get overwhelmed and can be incredibly inefficient, and you're not going to be able to get the resources where they need to go as quickly as possible.
Right, exactly. So you can go on to the next one as long as that makes sense. Tom insisted on putting his picture back in here.
Okay.
So here's typically what we're seeing out in the field. Our tables set up in one fashion or another with all the meals already prepared by the workers. So you can go ahead and move on. So some of the things that we're concerned about, communication, making sure that all of your eligible school community members know where the lunch pickup sites are and what the hours of distribution are going to be. I don't know if anybody saw the article or saw what happened in Philadelphia on Monday, but the city of Philadelphia put out 30,000 meals on Monday. 8,000 of those meals were actually picked up.
Wow.
So they wasted 22,000 meals. One of their issues that they revealed through this was that apparently they did not message in Spanish in many communities. So the Spanish community did not necessarily get the message that the meals were there. So, there's a number of different things that might be behind this, but making sure that they're aware, if they're eligible, of when and where to pick up these meals is obviously the first consideration. So using what you have, your robocalls or your email chains or your social media options. We always talk about that redundancy. Pushing this out a couple different ways is your best means to make sure that everybody knows how to get their meals in the first place. So you can go ahead. Food safety. So one of the dynamics that we're seeing out in the field is that we're talking about social distancing. You just mentioned the lifespan of the virus on different packaging. Mm-hmm. I think it's 24 hours on cardboard and 3 days on plastic, and what stainless steel and copper have different shelf lives for this. What we're seeing is that at the very, very beginning of this equation, you have people preparing the food. From everything that I've seen so far, they're finding that food that's been cooked and served is not as susceptible, and that I don't think there's any known transmission through that process. It's the raw food and the food that's not properly washed or that might have been touched post preparation or during preparation that's the issue. So our biggest concern right off the bat should be that the people are well who are handling the food and who are handling these packages. I'm not telling anybody to do this, and I don't know what union issues or legalities might be involved, but I do know a school district that had a very unique solution to this. They are screening their handlers every time they come in to prepare food. Before they come in the building, they ask them how they feel. They ask them if they're experiencing any shortness of breath. If they answer those questions in the negative, then they're permitted to go in and go ahead and start work. After, they use a thermal scan thermometer to just make sure that they don't have a temperature. So that's basically the system that they're following, just to basically screen and say, do you feel okay? Do you have a temperature? Okay, go ahead and handle the food.
And just to remind folks, we did include the CDC guidelines on food safety and food handling as well.
Right. And so, that's something that I don't think too many districts are doing right now. I only know of one. And then the preparation and handling practices that you're pushing those resources out. The personal protective equipment, the masks and the gloves are typically part of this equation. So you can go on to the next one. On site. So the guidelines, they're going to be similar to your summer feeding programs, right? The idea is grab and go. It's not congregate feeding. We're not trying to put people in a room and feed them a meal. We might as well just have school if we're going to do that, right? One thing that we're noticing is that some schools are bringing people into the building, into a vestibule or into a hallway to provide the meals. In the previous portion of this, we learned that the aerosolized droplets, they have a life in the air, right, of about an hour, I think. If we move that operation outdoors, then obviously with wind current and dissipation, I think that that's going to be less confined and greatly reduced. So keeping people out of the building for a number of reasons is beneficial to us. Once you bring somebody in a building, you also have the likelihood that they're going to be in close proximity to someone else. So we've seen some unique ways to handle that. Outdoor locations minimize the proximity. It facilitates the dissipation or dispersal of the droplets. And while we do this, a no contact process is our best bet. And so what we've found is the best example that I've seen from with my limited knowledge on this, but just common sense, and it's not being exercised in most places that we've seen so far.
Okay.
We have a drive up or a walk up along the curb. We have it coned off, right? So that the cars, nobody can park there. No one is in the way. They put a single table out by the curb. In some cases, you can put two tables if you have enough room to have two stations. The food workers remain at a table back by the building with the meals. The vehicle drives up or the pedestrian walks up and is asked to stop at a post about 25 feet from the table. In this case, they're asking for names because they have a lot of kids with food allergies. Once the name is conveyed at a distance of about 25 feet, the worker grabs that meal for that student, proceeds to the table, places it on the table, and returns to the building. And then the parent walks over and picks up or gets out of the vehicle and picks up the meal and proceeds on their way. This no contact method prevents a lot of what Tom and I have been seeing and my team's been seeing out in the field. We also have vehicles that, they'll pop the trunk and the worker will just put the meal right in the trunk of the car and move on so that there's no contact and no conversation. The particular school that we're seeing, they are, after every 5 visitors to that table, they wipe down the table and they change their protective gear. They change their gloves, they change their mask, and they start all over again. They just continue the same process until they're done. Also understanding that when we're aggregating meals or while we're placing meals on these tables, we have to watch out for our allergies, right? So,
Yes.
even putting them on the same table can be a problem. So that is the process that we've seen that I think has the greatest chance of minimizing the transmission of this virus. Tom and I today were watching, we pulled up to a school, they had the table out by the curb, it was loaded up with the meals, and there were 2 servers handing out meals. One of them was wearing gloves and a mask, the other was not. So think of the optics when you pull up as a parent. Which one do you want to hand you a meal, right?
Of course.
So there's no consistency there. And then the second thing that happened was a parent walked up to the table and immediately he and the server shook hands and stood and talked for a minute.
Oh boy.
So by taking a process like this, I know it's socially awkward to not shake hands, right? It's hard to keep our distance. This really kind of forces it just by process. So that's the thing that we've seen that's working well at this point. You can go to the next. You can go ahead, Dave.
So considering a law enforcement or security presence to
Oh, I'm
address
sorry.
traffic concerns?
I expected a different slide next. Yeah, so, all of the sites that we visited thus far had police officers at the sites. We've got a concern for traffic. If people are walking to and from our site, we don't want them struck by vehicles. If we've got vehicles coming in and out of our campus, we want to make sure that we've got a delineated route, and the best people to handle that type of circumstance is law enforcement, right? Getting ingress and egress safely accomplished, and then general security at the scene. We don't know right now. We're seeing a very light flow to these sites, but let's assume there's the worst case chance and somebody ends up in some type of a confrontation over food or something else at that site.
Sure.
We're much better off to have some type of a security presence and not be relying on somebody's aunt or uncle or whatever the case might be. Go ahead. So this is the example of the school that I just gave you. They provided this particular map to all of their parent community, their guardian community. So it tells them where to pull in, where to stop, where the tables are going to be set up, and how to leave, and they give them the instructions. State the child's name, go to the table, retrieve the meal, no contact. And they've had a very good flow to and from their building by doing this.
And one of the things you mentioned was student allergies. So you might want an independent pickup area, wouldn't you think, for students who have nut allergies, for
Right,
example?
and so they're using 2 tables, and that's why they're asking for the student's name, so that they can bring those particular meals out to the student with the allergy and serve it away from all the other meals. They have their meals back by the building, and the meals are segregated back by the building, so they're not putting potentially foods with potential allergens with the rest of the meals that everyone else is getting. This
Good.
particular district, um, the first thing that they actually did was they called every single student, or their guardian, obviously not the student themselves, and they asked them if they wanted the meals. They had an awful high number of people that just opted out and said, no, we'll be okay, we don't need our meals. The next question that they asked them was, are you able to come pick them up and willing to come pick them up? All but 10 people in their district, and it's a fairly rural district, all but 10 said that they would be coming to pick up the meals. The remaining 10, they are delivering. So we know these challenges are going to differ across the state. Their delivery process is to use a bus. They put the meals on the bus and they use the same process. The meal server gets off the bus with the meal, approaches the house, puts the meal on the porch, knocks on the door, walks back to the bus and waits to see that it's retrieved before they move to the next site. So
Yeah.
the same overlay that you're looking at, that's their delivery in the field process. That's what they're doing with the 10 people that couldn't get their meals.
Okay.
You can go ahead to the next. This is what it looks like on the ground at that same school.
Good.
So you follow this cone line. You're either inside of it if you're a pedestrian, you're outside of it if you're a vehicle. And those are the 2 tables. And you can see up by the building the people that are ready to walk out and put the meal on that individual table. So what we're seeing, again, placing all those meals on one table, you're risking, number one, the contamination of the bags by somebody that's coming up and potentially sneezing on the whole table, right? Distributing the food indoors risks your building contamination, and it also negates the social distancing that we're trying to accomplish. Another thing that we saw at one of our schools was they had a clipboard, and the parents had to pick up the clipboard and write down who they were picking a meal up for, which obviously is another means of transmission, and it's also causing some delays. But most importantly, I think it's not necessary. So I'll explain that in a second. But those signatures, now we're sharing pens, we're sharing the clipboard.
Yes.
And then the last thing we've seen is a very low pickup rate for the meals. District I was in today, I think they have 2,400 students. They're all eligible because of the community. I believe they prepared 800 meals, and I think they had 300 picked up. They ended up donating to a food pantry the rest of their meals because they had nothing to do with them, and they were going to go to waste. So I think that the school that asked, that's all right. I think the school district that kind of asked the question up front is a little better position. The thing I think is important to remember with that dynamic, there are a couple things. One, maybe everybody wasn't aware of how to pick up the meal. Two, we've had a couple concerns expressed that people are embarrassed to come and pick up the meal because, in this particular district I just mentioned, it doesn't matter because they all get free meals. It's not a matter of economics for everyone. So
Good
nobody.
point, though. You could have a real stigma and
Right.
concern over that. Yes.
Right. And so so now that kind of translates into a big problem from one school, if it's true that I heard related up to me, is that they did not want the emergency management office to be involved in the delivery because now you're exposing us outside the school community to other people that now know we're getting a free meal that didn't previously. So,
Okay.
that could really upend an operation somewhere if they don't have the staff to hand out the meals. The only alternative is to hand out no meals, I would guess. So that's
Yeah.
not helpful to anybody. So it is a concern. The other thing is that right now, people haven't run out of money yet. People haven't been put out of work for an extended period of time. It's entirely possible that as this goes on, and if it's prolonged, people are going to have less and less available resources at home, and they're going to rely more and more on the food at the sites. So I think everyone would be wise to try to get a handle on what they're actually putting out every day and what's actually being accepted, because we don't want to run out of wasted food in the beginning and have nothing on the backside. So that's something I think we need to start keeping our eye on.
So we do have a challenge, of course, with our time period for today. So I do want to ask Rebecca if we have questions thus far that we should be addressing.
We have a tremendous amount, and some of them I've directed to the resources that we've given. One question is, if you're using a food service, is the school responsible for the health of the workers?
So
Sounds
if
like
you're,
sounds like a question for an attorney. I was just
okay.
Okay,
So if you're,
I'll tell them to
if you're,
check with their attorney,
if you're
okay?
using a food service company,
Like
uh,
one of the companies that we outsource to, if you're using their food workers, who's the idea of what you talked about of checking the health of your handlers. They wanted to
so
know if the school should be doing that or the company should
it's
be.
important for the district to still have a plan in place to make sure it happens, because ultimately, whether it's a district employee or not, you could potentially be compromising the health of your kids. So the district has to make sure that process is in place, which might mean they need to be hands-on in doing the process
Okay.
themselves.
Okay.
So
That was good. And we had another question. Can the doctor please repeat how many breaths per minute a good reading is so that you know that you're not ill?
Well, obviously, it depends on your age and depends on your size, but the average adult is 14 to 21 breaths a minute or less, and the child is usually about, depending upon their age, can be anywhere from 18 to 30.
Thank you. And the most asked question is, will we be posting this with sound, and will we be posting it as soon as possible, because everybody is very grateful.
And we will be. We're going to make this available very quickly. We will turn it around and make it available with sound for folks to listen to, and it'll be on the NJPSA website.
Thank you.
So Jeff, I believe you had this slide as well on crisis
Yeah,
counseling
I
for
only had a
students.
couple, there were only probably 2 or 3 left, and they're real quick. This one you already addressed, so we can move right past it. You put out all the documents. The drilling requirements, we're working on this. I mean, I don't think that there's any real expectation that, number one, nobody's in school right now, but I would not be putting kids in a corner on top of one another for a lockdown drill when we're worried about transmission. And the other is that, obviously there are schools that are not going to meet the requirement legally at this point because they didn't do it in the first 2 weeks. And there's, the rest of the month, we're probably not going to be in school. So we'll have to get some dispensation on that. I did speak to the commissioner. Right now, the school's meeting this requirement is not a big concern of his. So, I don't think anybody should be really worried about it right now.
So
Go ahead.
So yeah, with that, I do want to make sure we have a few moments. We're sort of making an executive decision that we are extending the time period for those who are able to stay with us so that we can review some key considerations regarding special education and related services. We will not go later than 15 minutes overboard, but we do want to have some time for a set of critical issues regarding special education and related services. So
Dave,
John,
if I could just get 30 seconds, the one other slide that I think is important to note, the Department of Agriculture, their food and nutrition, they have their own office. I had a conversation with the commissioner yesterday. They do not require anything other than a total number of meal counts. If you're working under their program, then all you need to know is how many meals you've handed out. You do not need to know who you handed them out to. And they asked that any questions about that aspect of this whole service be directed to the Department of Agriculture. That's all I got.
that's great. And that's actually just to reinforce that point, we did provide the March 17th Department of Education guidance document, and it includes all of that information, very specific information on how we address the food issues and make sure that districts can receive the resources that they need on that issue. So that's great. All right, John, I'm going to ask John Worthington to walk through some considerations regarding online instruction, evaluations, IEP meetings, compensatory services. So the U.S. Department of Education did put out a memo very recently as well. We give you a link to that memo. John, do you want to talk about the online instruction and services piece?
Oh, yes, thank you. So with regard to the online instruction, as David noted, there is a memo from U.S. Department of Education. Basically, in their guidance, they're saying that if you close all your schools and don't serve any of your students, general education students, you also would not be required to serve your special education students. So they do note that specifically. They also note that if it were something that you could have done, it's probably too late now, but you could have a contingency plan in students' IEPs where you could determine what you would do, what kind of services you provide in the event something like this occurs. But at this point, the schools are already closed, so it's a little hard
And of
to
course,
add that to the IEPs at this point.
and to be clear, at this point, schools are closed and they are serving all students.
Yes, exactly. And I was going to say now on the next slide, if you continue to serve all students, the U.S. Department of Education made it clear students with disabilities have to have equal access to the same opportunities. So if you're providing online instruction for your general ed students, you would also have to do that for the special ed students. Note the quoted text, to the greatest extent possible, you're going to provide students with disabilities the special education and related services in their IEP. And again, emphasizing virtual or online instruction is noted as an option by the U.S. Department of Education for delivering the special education services to students. New Jersey Department of Education also issued a memo on March 5th, which, as David noted, it's been updated on March 17th and probably will be updated in the future. So keep looking for more updates. But they note that if school is closed by the Department of Health, which all schools are now closed, online instruction may be utilized to provide instructional services to all enrolled students. Again, this would include students with disabilities would be able to be instructed that way. All of you have already submitted your plans to the Department of Education for review. In there is how you're supposed to detail how you'll serve the students with disabilities. So we'd be talking about special education and related services. As David had noted in the beginning of the webinar, make sure you're following your plan as far as how you plan on providing that special education, how you'll provide the related services. Whatever is set forth in your plan is how your individual district needs to serve your students while the schools are closed. One question that's come up is related services, if they can be provided online or through use of take-home packets, some combination of those. Note that New Jersey Department of Education, it doesn't currently authorize the provision of related services through online means. However, some districts I know have included that in their plans as how they will deliver those services. We would look at that. It makes sense to include them in your plans at this time. It's a unique circumstance, an extraordinary circumstance. The U.S. Department of Education guidance certainly suggests the use of online means to provide the related services or special ed and related services. So districts including that in their plan and basically erring on the side of providing services to students appears to be a good way to do so while the schools are closed. We would note that you should always consult your board attorney for how you're going to do things. And if it's not in your plan for provision of services, you should consider amending the plan that you submitted to the Department of Education. If you want to start providing related services online, it would be a good idea to amend that after consulting with your attorney, just so the department knows, exactly how the district plans to provide those services going forward. On the next slide, talking about compensatory services, do note that in accordance with the guidance from the state and federal Department of Education, when your schools ultimately reopen, you're going to have to look at individual circumstances, determine whether an IEP meeting is necessary for a student to consider provision of compensatory services, and then the IEP team would have to determine what services, if any, need to be provided to compensate the student based on whatever occurred while the schools were closed. We do include some suggestions, questions that you can ask as far as the team when they're analyzing the question, how far has the student regressed in any given area, what instruction or related services should you provide in order to bring the student to the point where you could provide them a FAPE or free appropriate public education going forward. Note the highlighted area though, it doesn't necessarily when the team meets mean that you'll go hour for hour on missed instruction, hour for hour on missed related services. The team would have to look at the totality of the circumstances, decide for that individual student what compensatory services, if any, should you provide to bring them to the point where going forward they can receive a FAPE. So that will be individually determined for each student and not necessarily one-to-one. And do note at the bottom, whether or not you provided services, whether it's online packets, some other means, it doesn't necessarily mean because you provided services, you don't have to, in some cases, consider whether the compensatory services should be provided to a student. It's always an individual determination whether the IEP meeting is necessary, and if so, the team would decide what, if any, services are necessary for a student. Questions have come up with regard to initial evaluations. Do you have to conduct them while the schools are not in sessions? What we would say is, if you have necessary student record information, because your staff will be working at home, so it will depend on what access they have to information with regard to the students, complete those aspects of an initial evaluation that you could do while working remotely, anything that's feasible. Individual testing of a student's not going to be feasible at this time. An initial eval includes a minimum of 2 assessments. That's something you're probably not going to be able to do. You would do what you can, though, complete the rest of the aspects of the initial eval when your schools ultimately do reopen is when you would have to do that. Things that you can consider on the next slide, we talk a little bit about areas where you probably could get some of the initial evaluation completed. The functional assessment, parent and teacher interviews, reviewing developmental academic history, interventions and like could be reviewed. Note at the bottom, certainly the school nurse could provide the summary of available health information, assuming she has access to the student record information in order to do that. These are types of things that could be completed, and then you could complete the remainder of the initial evaluation when schools reopen and you're able to do so. Same question came up with regard to reevaluations. Again, you should do whatever pieces of the reevaluation you can complete while the schools are closed, gathering certain information and the like. You could do that. You could then conduct the remainder of the reevaluation when school reopens, just like you would with an initial. But do note, remember, with reevaluations, they do not require assessments. So it is possible you could hold the IEP meeting. If you determine that assessments aren't necessary, the parent doesn't request an assessment, you may be able to complete the process remotely through, virtual meetings, doing it that way. We'll talk a little bit about IEP meetings in a minute, but you could hold the meetings and complete the reevaluation if assessments aren't necessary without the need to hold it during the school closure. And also note the rules do allow for a waiver of the reevaluation. Staff should be able to, if the parent and district agree and the parent consents, you should be able to complete that paperwork to waive the reeval process, which is a waiver of the incomplete process, and then a new 3-year period kicks in from the time the parent consents. That would be able to be completed, at least if you have access to enough information, while the schools are still closed. You should be able to do that. Now, I mentioned IEP meetings. Do keep in mind the state regulations don't actually specifically provide for having meetings by audio or video conference. However, if it's in your plan to have meetings where you would do them virtually, this is an extraordinary circumstance where it would appear to be a reasonable means of holding IEP meetings where all the attendees could appear by audio or video conference in order to hold the meetings, such as for reevaluation and annual review, because it is springtime. Most of your annual reviews are probably going to come due now. If you are going to do meetings this way, we would suggest that you amend your plan so that the department understands that you'll be holding meetings that way when you're completing your tasks for special education purposes. And just a couple suggestions: if you're going to have the meetings, you might want to get parent consent. Only hold them if the parent's going to consent to holding the meeting that way. Only do so, obviously, while the schools are not in session. Once the schools are back in session, because the rules don't call for meetings that way, you would go back to in-person meetings. And you should always document this and anything else you're doing with special ed, especially during this time period. Document the need, the reason for what you're doing, why you did it, annual review, reeval, whatever it may be. Make sure you're documenting what you're doing, the reason to do it, and how you proceeded basically while the schools were closed, and adapted, and documenting things in the plan is certainly a good idea.
So let me pause at this point. Rebecca, do we have specific questions regarding special education or related services and what John has reviewed?
John did such a great job that he answered every question I had on the special ed list.
Very impressive, John. Thank you. So just one closing comment from me as we're looking to wrap up this presentation. As a school administrator, we have to think about the critical role that all of our school administrators need to play in this process. So one issue is ensuring that your district plan is complete. Make sure that the types of things that we've talked about today are fully addressed. Make sure the plan is understood by all stakeholders and is implemented. And this is challenging. We are in uncharted territory. It is almost inevitable that you are going to have to make adjustments to these plans because we don't have a clear roadmap on these issues. We're working them through together. So make sure that you're constantly evaluating that plan where things are not working well, that we identify that, we address that issue. We always want to use as one of our guiding principles, make sure that the plan is equitable, that we are reaching all students, and that we're not underserving some of our at-risk populations. And we also have to ask, even though this is a very challenging time, we have to ask questions about the effectiveness of the approaches that we're taking and be willing to identify areas where we need to improve. We're also going to have to take some lessons from the medical field, and the education field has done this for many years as well, and think about triage systems. We have to be able to quickly identify and address emergent issues, especially issues that could affect the health and safety of our students and our staff members. So if we see emergent issues, for example, in the area of student mental health, the risk protocols that we talked about have to be there. Those systems have to be in place to make sure that we are addressing those issues very quickly. And the school leader plays a huge role in this process in creating a positive school climate, taking the time to reach out and be supportive to students, to parents, to staff members as we work through all of these challenges because we are in this together. We do have to ensure appropriate accountability and make sure that folks are doing their work, but we have to also make sure that everyone realizes we're here to support each other and that together there's nothing that we can't overcome in this process. So I want to thank our incredible set of presenters for today and for all of the information that you have shared. Rest assured for those who are listening that NJPSA and FEA are here as your partners. We're going to continue to provide ongoing resources and support for you throughout this process. You may have questions, of course, that we were not able to answer given our limited time today. We do encourage you to email questions that you might have, to also constantly be checking in on our website. We will be providing updated information. And we do know that in these difficult times, we still have to make sure we're addressing the ongoing professional learning needs of our staff. So we do give you here a link to information about the many online webinars that we have made available during the 2019-20 school year, and they are still all available for all of our participants. With that, I want to thank everyone. Thank you so much for being a part of this critical presentation. Thank you for all the work that you're doing on behalf of the children of the state of New Jersey. And we are in this together and here to support you as we move forward. So thank you everyone for being part of this process, and we will make this webinar available publicly and on our website in very short order.